Let's dive into the science and application behind the frameworks Dan and I use when building exercise, training, and workout programs so that they can be optimally integrated into your particular life with your current goals. Typically, people start programs in one of two areas. Either they have a specific goal in mind, they want to get stronger for a particular event. They want to perform in a sport that they know that has a given day and a time and a competition. Or they actually don't know. They want to just feel a certain way and they want to make sure they're being healthy. And they know exercise is an important component to that, but they don't know their actual goal yet. So either one of those cases, you know and you have a specific goal, or you actually don't, we want to give you some frameworks about how to approach your program in both scenarios. Now, if you have a goal in mind, specificity will always be the answer. You want to get stronger? Make sure we're dialing in around strength in that area. You want to lose fat? Great. What are the optimal program strategies for fat loss? If you in the other case, and we're really doing this using exercise as a modality or a means to get something else, we need to spend a little bit of time thinking about where are we truly at, what's hindering us from our current performance, or what I call what's defending you from that current goal, as that will then give us a strategy to get to that first step of specificity. Let me give you a quick example. So let's say you're coming in and saying, I want to exercise, I know I want to lift weights and integrate endurance into my program because I know that's important for my health long term. Where do I start? I'm going to run a quick analysis and figure out what's your biggest area of concern, and maybe we're going to start there. What have you done the least of? What are you the most furthest behind on? And we'll be a little specific in that program and move ourselves on to the next goal a little bit later.
Once you have your specificity lined in terms of your goal setting and everything that you're going to be doing with respect to exercise selection and your program design, I can't emphasize enough how important it is to logically, progressively overload this in a way that you can measure. One of the biggest reasons people enter the gym on day one and then 10 years later kind of look the same is because they have allowed compensations and movement patterns to become slightly sloppy in order to gain a false perceived exception of an overload that's not actually happening. For example, if you're doing a bicep curl and you have a weight that you can handle, you will be at full extension in the bottom, you will come all the way back up, and you will control this on the way down. But next week you want to add 10 pounds, so you might only get up to here and then come back down. And then a week after that, you think you're getting stronger, you want to add 10 more pounds, and then your hips start getting into it at this point. What's happening is you're adding weight to the bar, but not actually progressing at all. You've put more weight on the bar, but you're not stronger. All that's happened at that point is your movement pattern has gotten slightly sloppy. You have compensated in order to create a false perceived narrative that you are progressing when you're actually not. One of the most important things you will ever do in the gym is be honest with yourself. You have to be honest with respect to your full and controlled range of motion, or what zone you're training in, or your breath rate, or your mobility, your movement quality, you name it. Once that goal is set and your specificity is identified, arguably the most important thing you could ever do is properly measure it so that you know how to properly overload it and whether or not your program is actually working or not.
I've been teaching academic collegiate courses on the science of exercise for over a decade, and so I have a lot to say on this topic. But I think we can actually extract some of the most key and important lessons from those courses that you need to know right now to help you build the best program possible, or at least give you the frameworks needed to understand the science behind exercise science. One of the most important scientific concepts is what's called the SAID principle. That stands for specific adaptations for imposed demand. What's that mean? If you find the physiological limiter, you find the physiological adaptation. Meaning, when you go do any type of exercise, any reps, any sets, any style, any mode of exercise, and you start getting limited by a certain aspect or area of your physiology, that's the place that has the most stress applied upon it. Therefore, that's the place that will have the most adaptation. Let's say you're doing sprints up a hill and you're getting fatigued because your quads are blowing up. What that probably means is that is the place that has the most imposed demand, so that will be the place with the most adaptation. If you're doing that for the sake of cardiovascular health, but you're only reaching a heart rate of 135 beats per minute, and your respiratory rate is 16 breaths per minute, you're getting a little cardiovascular fatigue there, but you're not getting a lot of adaptation because it's not actually being placed upon a lot of stress. If you were to flip that, do that exact same scenario, you're running up a hill and you're at a max heart rate and you can't catch your breath and your legs are a little heavy but they feel fine. In that exact scenario, with the exact same workout, you probably have a different place of adaptation. So said principle is going to tell us the place that is the physiological limiter is the place of adaptation. So when you go to about thinking about your program with this very first scientific concept, we want to think about what am I trying to get done? What part of my physiology or my body am I trying to improve? And then making sure you're putting yourself in a position where you can continually challenge that specific area. The third scientific principle is variation. Now that may sound a little bit counterintuitive there. I started off by saying be specific, and then Dan said overload that thing, and now I'm saying have variation. Well, it's all true. Remember, specificity drives adaptation, but it also drives fatigue. And so we need to be really careful with how much precision and specificity and use we're doing, especially when we start to overload it. And so you want to have a nice balance of variation. What's that mean? Slightly different movement patterns. So if you're in the gym, not doing the same exact setup on your squat, maybe changing the barbell or the dumbbell, your foot position, your hip position, maybe the angle of your back. Maybe changing your endurance work from running to swimming, to biking, to pushing a sled. Maybe changing all that entirely and doing bodyweight movements, getting an exercise class, picking up a sport, doing jiu-jitsu, surfing. All of these variables ask slightly different demands of your body. So you want to think about variation as in the short term, specificity gets us closer to our goal. So if you have a very short term or timely goal, we want to be more specific. You have a competition, you have an event you're preparing for, you have something you really want to get done in a certain time frame. Be more specific. Outside of that, you want to zoom out and be more general. The classic approach for an athlete would be general at the start of the offseason and getting more and more specific as we get closer to the season. This variation allows you to move in different ranges of motion, work in different energy patterns, utilize different musculature, identify different timings and firing patterns between muscle groups, and have this overall connection. It also allows you to reduce the chance of overuse and repetitive injury, soft tissue, musculature, or even bone. And so really making sure we're thinking about, have I been doing the same thing for a very long time? Yes, I want to progress it and overload it, but am I really now at the point where I should add some variation? Okay, so regardless of your goal, you want to think about that. If you do too much variation though, we're really compromising our ability to make change because we lack too much specificity. So you want to balance these two things, specificity and variation. This allows you to overload appropriately without getting into excessive risk and getting your recovery capacity too low. If you do that, that then really ultimately limits your ability to continue to work out, to continue to train, and what you'll see long-term, consistency and adherence is always the single biggest factor to determining success over months and years, which is at the end of the day what we're all here for.
So at this point, we've gone over specificity, overload, and variation. We're working on what we need to work on for our desired outcome. We are overloading the process to ensure we are making progress along our road and that our program is effective, and we are varying things along the way to avoid injuries, to stay psychologically motivated about the process, and to ensure that we have both a general and specific approach for the larger big picture vision of program design. All three of these need to be wrapped up really nicely in the fourth principle, which is fatigue management. No matter how well you have these three dialed in, it doesn't matter if you're not properly recovering. When you are in the gym, if you have a baseline of fitness, you are going to create some form of fatigue merely by training. Your job outside of the gym is to not just get back to your baseline, but to adapt and actually become a better version of yourself in whatever your specificity stimulus was. Fatigue management is what allows this to happen. So proper lifestyle strategies, proper nutrition strategies, proper supplement strategies, different recovery protocols, the overarching fatigue management with respect to these components, but also with respect to periodization models and incorporating deloads, complete off weeks, active recovery periods. These are all different ways in which you can manage fatigue in the big picture and in the small picture so that you don't just recover to baseline, but you truly make progress each and every single time you apply the science of these principles.
Let's go over a specific example. One of the most common questions we get is, look, I want to get stronger, add some muscle, and improve my endurance. How do I build this all into the same program while hitting those 4 scientific principles of specificity, overload, variation, and fatigue management? Of course, there are tons of evidence-based approaches to solve this problem, but I'll just give you one as an example that Dan and I have used a lot in our coaching practice. You want to make sure you're not having a slight combination of all 4 of these principles, because it will actually result in you getting nothing done. And so you want to pick a priority. Again, just as an example, maybe you decide I'm a little bit higher priority right now on my strength and muscle size. So what you might do is something like 3 to 4 days a week of heavy or moderate lifting, and then 1 to 2 days a week of some endurance work. You're not going to progress that stuff over time. Maybe you pick a method of endurance work that is easy to recover from. Let's say cycling or swimming. We're not adding a lot of eccentric load and landing on our legs like we would be if we were, say, running or doing something else like that, because that's not our priority. We want to keep our fitness at a baseline level. We don't want to lose what we currently have, and so we're going to do just enough to maintain while we prioritize our strength and size. So we would progressively overload our lifting. We would add a little bit of variation within those movement groups so we can continue to work there. And the specificity already came in by focusing more on the lifting than the endurance. And so we've hit all of those variables, and we would stick with that plan for maybe 6 to 10 weeks. Somewhere in the middle there, maybe at the 4, 5, or 6 week mark, we would have a little bit of a deload. We would back off and recover so we could come back and progress for that next maybe 3 to 5 week phase. At the end of that thing, we maybe now transition into slightly different priorities. So maybe we back the lifting off to 2 to 3 days per week. Maybe we take the volume down a little bit or the intensity, and we do just enough to maintain. We have some overload, and we really start to maximize the variation. We have more changes in our exercise selection. We pick different stances and barbells and methodologies and things more frequently. We lose some specificity there, but we're hedging more towards variation because we're going to start adding more specificity in our endurance work. We pick up a session. We have more specific time domains, tempos, pacing, anything like that that happens in that realm, and we just put a little bit of a higher priority there. So that's how we would really balance all those in that scenario.
I also think it's important to take a step back and mentally get yourself in this game too, because many people think they absolutely have to pick either strength or endurance. So a great model that he's presented here is one that is workable for anybody who wants to accomplish both at the same time. Like, if you ever met a football player, you ever met a rugby player, Andy and I have worked with tons of fighters who have a lot of muscle and insane endurance. So I don't want you to ever think that you have to fall into the trap of only doing one thing at a time. It is completely dependent upon how you manipulate the principles. When you're manipulating these principles and you're using the methods associated with those principles, you are able to accomplish more things than one at the same time. Don't hold yourself back. Just use the science as your weapon to get done what you want to get done.
And if you don't believe me, think about it this. I actually personally know somebody who had their first child, ran their first ever marathon, having never run ever before, and benched over 400 pounds within a year, using almost this exact same model.
Yeah, in less than a year, all 3 of those got knocked out. So yes, it absolutely can get done.